Ozempic, Wegovy, and Mounjaro. These names are everywhere, from celebrity headlines to everyday conversations. These injectable drugs, first developed for diabetes, are now at the center of a revolution in obesity treatment. Obesity rates in the US have soared, with over 42% of adults affected, leading to increased risks for heart disease, diabetes, and cancer. Unlike past fads, these medications represent a real scientific breakthrough, changing how we view and treat obesity. Their popularity has sparked shortages and tough questions. Are they miracle cures? Who should use them? What are the risks? As a neurosurgeon and journalist, I want to cut through the hype and give you the facts. We'll explore how these drugs work, who they help, and what you need to know to make informed choices. Let's move past the headlines and get to the real story behind this new era in weight loss. For years, obesity was blamed on lack of willpower, but science tells a different story. Obesity is a complex disease shaped by genetics, environment, and powerful hormones that regulate hunger and fat storage. Some people are genetically predisposed to gain weight more easily, making weight loss an uphill battle. Our environment, packed with cheap, processed foods and sedentary lifestyles, makes healthy choices harder than ever. Hormones like ghrelin and leptin control hunger and fullness, but in obesity, these signals often malfunction. After weight loss, the body fights back with intense hunger, making it hard to keep the weight off. This isn't about weakness, it's biology. Understanding these forces is key to finding real solutions. That's why new treatments target the body's own systems, not just willpower. The science of obesity is finally catching up to its complexity. So how do these new injections work? They harness your body's own hormones to help control hunger. Drugs like Ozempic and Wegovy mimic GLP-1, a hormone that signals fullness and helps regulate blood sugar. By amplifying this signal, these medications quiet constant food cravings and help you feel satisfied with less. They also slow stomach emptying, so you stay fuller longer and naturally eat less. Newer drugs like Mounjaro and Zepbound go further, targeting both GLP-1 and GIP hormones for even greater appetite control. These aren't magic bullets. They reset the body's hunger cues, making healthy eating more achievable. The result? Sustainable weight loss, not just temporary fixes. These medications change the conversation from willpower to biology. They offer a new path for those who've struggled for years. The numbers are impressive, but real stories show the true impact. Sarah, a teacher, battled her weight for decades. With Wegovy, she lost 70 pounds, her blood pressure normalized, and her knee pain vanished. For her, the biggest change was mental. Food stopped dominating her thoughts. David, living with type 2 diabetes, started Mounjaro. He lost 50 pounds, his blood sugar improved, and he needed fewer medications. He could finally play with his grandkids without exhaustion. These stories aren't just about weight, they're about reclaiming health and hope. Treating obesity can reverse other chronic diseases, transforming lives. These drugs are more than weight loss tools, they're powerful metabolic therapies. The ripple effects go far beyond the scale. Real people are finding real relief. Not all these medications are the same, knowing the differences matters. Ozempic and Wegovy both use Semaglutide, but Ozempic is for diabetes, while Wegovy is for weight management at a higher dose. Mounjaro and Zepbound use Tirzepatide, targeting two hormones for even greater effect. Mounjaro is approved for diabetes, Zepbound is for weight loss. Clinical trials show Wegovy users lose about 15% of their body weight, while Mounjaro and Zepbound users can lose over 20%. The right choice depends on your health needs, insurance, and your doctor's advice. If you have diabetes, Ozempic or Mounjaro may be best. For weight loss alone, Wegovy or Zepbound are indicated. Off-label use happens, but always consult your doctor. These are powerful tools, but they must be matched to the individual. Personalized care is essential for safety and success. These drugs can be life-changing, but they're not risk-free. Common side effects include nausea, vomiting, and stomach discomfort, especially at first. Most people adjust, but some experience more serious issues like pancreatitis, gallbladder problems, or rare thyroid tumors. That's why these medications require a prescription and close medical supervision. They're not for everyone, especially those with certain cancer risks or genetic conditions. Be honest with your doctor about your health history and any symptoms. Rapid weight loss can also cause muscle loss, so resistance training and a protein-rich diet are important. Never buy these drugs from unregulated sources. Safe, effective use means combining medication with a holistic, doctor-guided plan. These injections are a breakthrough, but they're not a cure. Obesity is chronic, stop the medication, and weight often returns. The real power comes when these drugs are paired with lasting lifestyle changes. They make healthy habits easier to start and stick with, but diet and exercise remain essential. The public health impact could be huge, fewer cases of diabetes, heart disease, and joint pain, but access and affordability must be addressed so everyone can benefit. The future is about partnership, medicine plus lifestyle, patient plus doctor. These drugs offer hope, but the foundation is still good nutrition, movement, and self-care. Together, we can build a healthier future, one informed choice at a time.